is going to be the speaker in this session. Mr. Martashvili has a distinguished career in medical physics, educated in Georgia and then in the United States in the University of Tennessee. He has a multi-annual experience in research and in the clinical environment from several positions, including that of the chief medical physicist for more than 5 years. From 2019, he's a clinical application specialist at Align RT, and the last 2 years, he's a senior clinical application specialist. He's going to speak about the future of SGRT and the contribution of SGRT in SRS and SBRT.
Thank you very much, Dr. Michalis. It's a pleasure to be here. As always, Greece is quite on my mind. I've come here several times for trainings, and we have seen a good adoption of SGRT technology in the clinics so far. And today, it would be my pleasure to give you some more. It's good? No? Give it a try. All right, sorry about that. All right, so today I will give you some insights to what SGRT has been and how we are developing this technology for the future. And my main, I would say, the niche topic about SGRT adoption would be more about towards stereotactic treatments of cranium and the body. So if we talk generally about what SGRT is, if we ask professionals in a clinic, some people might say, okay, this is the surface monitoring system, it's used for treatment. Some people can say that, yes, this is a monitoring system that is also used maybe for simulation purposes to perform DIBH or 4DCT acquisitions without any surrogates. But the idea here is that if we look now towards the broader definition of SRS, if we take a little bit of a step back, SRS is, in a modern definition, more of an all-encompassing tool. So something that can be used from the whole radiotherapy workflow from start to finish, basically from simulation as well as the treatment planning. This is what you know. But the two main aspects of SGRT now are ability to utilize SGRT for treatment planning and also utilize this for the beam monitoring as well. So just a quick overview of what the SGRT is. It's a stereoscopic 3D surface acquisition technology. It's a fully optical solution that can detect in real time the patient surface. And normally we then compare it to some reference position of the patient. So that could come from the simulation. So when we do a real-time fusion of the patient's live position to our reference position, we can utilize it for two main aspects. And the first one is the patient setup. So we can repeat the same geometry, same patient orientation every day on the machine table. And the second aspect is also motion monitoring for the treatment. So we can, again, make sure the patient is staying in the same position, it's not moving, and if we have a connection to the linac, we can actually hold the beam and pause the beam if patient moves out of tolerance. This works in a similar setting. So for the tunnel-based linear accelerators, so you saw here the C-arm example, but for the tunnel-based or the closed-bore accelerators, there's additional degree of freedom because the systems now have two isocenters. One is for the setup and another is for treatment. So as soon as we set the patient up, the patient goes into the bore. We utilize now miniature SGRT cameras that can fit on the palm of your hand to monitor the patient into the bore. So these are different versions of SGRT corresponding to different geometries. The way it works is that And every camera that's mounted on a ceiling or maybe is inside the bore of accelerator projects a pattern onto the patient's skin that gives a bit of a texture to the patient. This is picked up by the cameras. We have 2 cameras in each pod, and it's turned into the 3D surface. So the information from all the cameras are combined into the full surface, and then it's compared to your reference surface, which will give us idea about the patient's real-time position. And when I mean the real-time, this imaging technique is truly real-time, so we can discern the patient's position up to 30 times per second, each second, so we can really see a very small, very minute motion that can be as small as 1.1 millimeter in 0.1 degree. And this, in the end, can be translated into the patient position and coordinates. So as you can see here, these are what we call the real-time deltas. They tell us where the patient is at the moment compared to where it's supposed to be from a reference, from a treatment isocenter position. So as you can see, these are in the table coordinates, and we can utilize this later to automatically move the table to the treatment isocenter by itself. So all in all, this is important. So from treatment planning perspective, we are taking this data from treatment planning system. So we need patient's treatment isocenter. We also need a surface that is generated by the TPS. And these are the only 2 aspects we need. And then we can import this data into LineRT and treat the patient fully using only these 2 pieces of data. Just to give you a taste of what it looks like, so here's the kind of like a cranium example. With the SGRT approach, you can opt out to open face mask variants for SRS types of treatments, where you don't need to use closed face masks anymore, and you can use an optical system to monitor the patient live. So what you see here in this picture, the green surface is kind of what the cameras can see or they reconstruct. The pink surface is what you have from the reference, maybe from CT planning. And in the end, you will see, even a bit with the naked eye, there's a longitudinal shift that can be applied, and cameras can calculate this fully for you, even before any kind of internal imaging is done. So SGRT can be used for any type of, I would say, localization or treatment site you have in a clinic. Popular examples are, of course, the breast DIBH treatment, but the very next example or very next common treatment site is actually stereotactic treatments of cranium and the body with SGRT. And all in all, it's really driven by the clinical outcome data. So if you go now to the PubMed, you type Vision RT, you type Align RT, you will find more than 200 publications concerning every treatment clinical site you see here in the picture. I mentioned very, I would say, direct setup or direct positioning of the patient even before the imaging is done. And this is a feature within Vision RT products in Align RT called postural video. So what you see here is a full postural alignment. On the right-hand side, this is the video feed overlaid by the peak contours that are automatically generated from your reference surface, and you immediately can know how the patient is set up, how the arm is positioned, how the torso is positioned, is the chin correct or not. So let's say if you are setting the patient up for SBRT, where the posture is one of your main sources of error, of patient misalignment error, you can really truly correct this live even before the patient goes for internal imaging. So you can set the patient up completely on the table and without need to use any marks. So you can even opt out to the markerless or tattoo-less radiotherapy treatments, which are, again, quite popular in nowadays radiotherapy. Align RT can also help you detect any kind of anatomical changes the patient might undergo during the treatment. So if you have some weight loss, if you have some swelling that you believe can affect your, let's say, dosimetry, you can quantify it and visualize where those are happening. And for example, here, AlignRT can tell you that 93% of your target area is within the 3 millimeter of tolerance from the reference. So you can see where the changes are, you can visually see where the swelling is and what is the quantification, what is the amount of that swelling. And you can see those areas overlaid by red for swelling, and if it's a weight loss, receding area can be overlaid by blue color here. And you can see this for selected regions of interest, or you can see it as well for the full body of the patient. Breath hold is quite a bit of a, say, direct way that AlignRT has been used as a new standard for those types of treatments, not only for breast and chest wall, but for SBRT type of approach. Idea here is that we recommend you to have both free breathing and breath hold scans done at the simulation. And with free breathing scan, you can do a full general alignment, postural alignment of the patient at the table. I mean, you can align the torso, you can align the arms, you can align the whole patient's body, not just relying on the marks and tattoos. You can do a full postural alignment of the patient. And then you can do a breath hold scan. So you switch now from the free breathing surface to a breath hold scan surface, and then you immediately see that your deltas are outside of tolerance. So normally AlignRT has a connection to the Linac, so it will automatically hold the beam if patient starts to move from designated position. So when that happens, you can coach the patient, let's say, into the breath hold level if you're treating in a breath hold, verify that everything is correct, and treat the patient in that position. So beam can be turned on and off automatically. So this is a quite powerful technique. It can be used for different types of SBRT treatments and has been used even within your region quite a bit for breath hold type of SBRT treatments like lung or liver type metastases. So tattoo-less, as I mentioned, quite a bit aspect of patient treatments with radiotherapy, and even the current research shows that there's a associated reduced amount of IGRT shifts, reduced amount of patient setup time, as well as the patient's throughput time. And you can view several centers around the globe offering those types of treatments to their patients. So I mentioned the second really common use for AlignRT is for treating the SRS and SBRT patients, and the outcomes, some of the clinical benefits I also mentioned before. But the idea here is that for SRS, we can opt out for open face masks without decreasing the accuracy of patient positioning and treatment. And for SBRT, you can utilize AlignRT's capability to position the patient, let's say, accurately, and the possibility to do breath hold types of treatments to reduce your treatment margins for SBRT. All in all, this is only possible if you have the optical system directly cross-calibrated to your Linac. An idea here is that you need to have a possibility to do an MV calibration. So you need to have possibility to calibrate your sealing system to the radiation ISO of your Linac. And this is especially important when we are talking about the non-coplanar treatments. So if you have treatment with couch rotations to increase your dose conformity, you need to have a possibility for AlignRT to directly rotate your reference according to your radiation ISO, your treatment ISO. So this is done by specialized calibration tool that's used with the centers with SRS and, let's say, SBRT capability, which is a cube phantom. It has embedded spheres, so you can do kind of like a Winston Lutz type of calibration for your optical system with this, where you can have a one-to-one direct comparison. So all in all, this gives us best-in-class accuracy for patient tracking. And that accuracy is under 0.5 millimeter for translations and less than 0.2 degrees for rotations. And this is for all orientations of the treatment machine. So whether you have the couch rotation, whether you have the gantry coming in different angles, partially blocking even view from one of the cameras or fully blocking the view by one of the cameras, that accuracy stays the same. And this is quite a bit of accuracy that's used, let's say, to do one of the most challenging treatments in radiotherapy, which is single isocenter multi-met cranium treatments like the hyperarc. So if we look at the, let's say, SRS cranium example, this is what it looks like. So we utilize Align RT here for initial setup. So we utilize the deltas even before you, let's say, attach the mask to the head of the patient. You can correct the cranium position, rotations, or any translations before the mask is applied. You can utilize postural video to check position of the bridge of the nose, let's say the chin of the patient, and you can see you can do this without the mask as the picture is showing here. After that, you can perform, of course, your internal imaging protocol. Normally, if it's a cranial SRS, you would default to CBCT. An idea here is that after CBCT is done and your internal shifts are applied, there you have a possibility, which is one of the stronger points of having Align RTs. You can capture that position with the cameras as a new reference, which was verified with your internal imaging, and then you can track that reference in real time, making sure a patient is staying still or staying in that position, even if you're rotating the couch. So even if you rotate the couch, that reference rotated, making sure in all 6 degrees of freedom, your patient is staying where it's supposed to be, okay? And this is without any additional imaging, without any additional X-ray radiation, and even if you have the couch rotations, of course, you know you have a collision between OBI arms and the couch, you can still use Align RT for tracking for the whole workflow. What does the guidelines usually say for this? So if you go in different guidelines, there are many of them you can go through. There's an ASTRO guidelines, TIPS-RO guidelines. One of the important ones there is the ASTRO-ACROP guideline from the last year, talking about implementation of SGRT in a clinical setting for SRS and SBRT. But as again from the last year, there's also AAPM new protocol, AAPM TG302, which is specifically talking about taking the SGRT system and putting it as a part of your clinical workflow, and how you would commission and accept the system in a clinic as well. So this is a really nice document to look through. I really recommend. And if you look kind of closely, I'm going to just say a few aspects for this. First one, what the document says.
You have 3 more minutes.
3 minutes, okay. So what the document says is you need MVQ calibration. So you Winston Lutz calibration. You have a possibility to quickly detect dynamic delta change, and you also need quick translational and rotational misalignment treatments. Okay, I'm gonna skip over this. Just wanted to show you this good result here. So this is from one of our end users here, Martashvili Hospital. This is the end expiration breath hold treatment for liver SBRT. You can see patient's alignment here, and post-IGRT, you would see basically no rotational misalignments for this patient. And the patient was, again, aligned with an SGRT technology here. A few other things I want to mention. So SIMRT is the SGRT system utilized in a city to do an acquisition of 4D CT and DIBH without any particular surrogates. And a bit about horizon cameras. These are the new standard for SGRT, and they are utilizing in now the products I was talking about in the beginning. This is the SGRT for treatment planning system and SGRT for dose monitoring. What are the benefits for having an SGRT for treatment planning? So we can actually detect and understand of all possibility, all phase angles for patient treatments. And we can detect where those possibilities lie for you, or which angles would be safe to treat, and where you have a possibility of collision between your patient in your couch rotation and your gantry and etc. This, on average, decreases normal tissue complication by 2/3 and increases tumor control rates by 25%. And this is what it looks like. So we capture the patient's full geometry at the CT sim, including with whole accessories, with these horizon cameras, and then we can build the full non-coplanar clearance map for this patient. So we put the patient in your virtual treatment bunker. We see which angles would be safe to deliver and where you have the collision between the gantry head, the couch, the patient itself. So you have the full geometry to understand where you are delivering from. So you can utilize this technology for doing a full 4-pi planning. So you can do a full non-coplanar planning for the patients where you really need to perform those types of manipulations. And you can do important changes here. So some of the examples here, so this is what it looks like. So you can see here this field kind of clears, but here you have a collision. So this is again from the testing. And we're also working with some of the treatment planning system vendors to give this information as additional degree of freedom, where we're changing the plans from here to here. And this is a clinical example from one of the last installations, Dijon, France. And just quick mention about beam monitoring system. This is the Cherenkov beam monitoring, where we monitor the dose in real time. Cherenkov light generated when the radiation enters or exits the body. And we have the possibility to detect a few things that we weren't able to do before, like the bolus misplacement versus the radiation field, MLC error here, or the patient's chin and arm moving into the field. So this is kind of what it looks like. Everything's real time, and it's also recorded. So just to give you a small taste, here again, patients moving the arm into the field, you can detect all kinds of things like this. Okay, so this is the idea, so this is our vision. So basically monitor the patient's position, posture, and also the beam delivery in real time with SGRT technology that expands the usage and utilization of such techniques for SRS and SBRT patients, where especially it counts, where you would really want to know your patient's motion management. Yeah, thank you.
Irakli, thank you for the excellent talk. A detailed description of the clinical use of SGRT and of the role of surface imaging in SRS and SBRT was given in this presentation. We have some time for a short question. Any question or comment? I would like to insist on a point which has been mentioned in many publications. It's about the implementation of SGRT and SBRT treatments, especially when motion management is required. There's a lot of discussion whether the patient's outer surface may represent the internal target motion. Since you are here, we would like to share your experience with us about the suitability of SGRT in monitoring this target motion.
Yeah, so that also, of course, is site dependent. So I didn't go in detail into the publication, so let me go a little bit back. So some end users try to look into that specific aspect of Align RT motion management. And this is the publication from 2020 by Hanserlinger et al. So where they looked for patient interfraction motion management for the lung SBRT patients. So what they did a CBCT initially. They would monitor the patients with the Align RT. If they detected meaningful shift, they would stop the beam and they would repeat the CBCT to look for vector shifts. Interestingly enough, they found that Align RT-based vector shift and CBCT-based vector shift were very correlated with each other, almost the same amount. Of course, it depended a little bit patient to patient, but again, it was a very nice tool to detect that small, meaningful motion where you want to have. And this is specifically done for the lung, in free breathing mode in this case. But of course, it is dependent a little bit on the site we're treating.
Thank you very much.
Thank you.
I would like to thank all of you for being here, and I also would like to thank Irakli for the excellent talk.
Thank you very much for the invitation, and thanks for the opportunity.